So what's your reaction to how the president handled the admission that there are problems today, that was certainly not what they wanted. They think it's unacceptable, but they're redoubling their efforts. I mean, bottom line, and he didn't sugarcoat it, as he said.
Well, I thought it was important, and you used the word admission, and I think it was important to hear from the president that we have problems, and some of them are serious problems, and it's preventing real access to the healthcare system and to registration, and those provide cannon fodder for the opposition. Those provide reasons to continue to try to pull the wings off the butterfly that I'm sure my Republican colleagues in Congress are waiting to do. I think that, it wasn't ready from day one. It's not ready now. Mm-hmm. And I think it's incumbent that become a priority because the uninsured have to be a targeted population and the young need to be a targeted population. And those are the ones that they'll try once, they'll try twice, but they won't persist in the effort to try to get on the system. So it has to be fixed.
One thing, though, that we noticed today was the president talking about this 1-800 line and getting people to call in. I called it during a commercial break. There is English speaking, and then there is Spanish speaking recorded messaging telling people how to get through. But tell us about the special problems with the healthcare enrollment in your district. This district also includes Tucson, a large Hispanic population now, and now there are further delays in the Spanish language website for ACA. So as I said, I know that they are trying to address that with the 1-800 line, but explain what you're seeing for the internet users.
Well, it's a hard to reach population of people, and initially the website didn't have the Spanish capacity that it needed to. The one that went online is having the same difficulties as the English version of it, and so that's a group hard to get, uninsured. The Latino population has the highest uninsured rate in the country of any population, and so obviously it's a targeted population, and this difficulty is preventing, and hopefully not for the short term and not the long term, people accessing which would be their first time to be able to have health insurance.
All right, so this still has major attention in Washington, D.C., the ACA. I wanted to ask you, though, about the other major issue, which is immigration reform. You've done so much work to get this passed. The Senate has its own bipartisan bill that it passed back in June. Last week, the president was urging Congress to take this up, to urge the House to go ahead and make some action on what the Senate had done. Do you expect any movement on that by the end of the year?
I do, and I think piecemeal approach is not going to be the solution. For leadership in the House to say that we have too much to do and can't deal with this issue of immigration being the top domestic issue, the most divisive issue that we have, and an opportunity to work on a compromise, go to the Senate, fix the flaws that are in the bill, and come up with something that is for the long run a piece of immigration reform. Yes, I have expectations. I think we're going to play out, unfortunately, part of the scenario that we saw with the majority in terms of what we were doing with the budget and the debt ceiling. But at the end of the day, it still comes down to the ability of our speaker to put something on the floor, and Mr. Boehner does that. I'm very optimistic that we have a very good shot at passing something and then going to conference.
Congressman, thanks for your time. I appreciate it. Thanks, sir.
Thank you very much.
Still ahead.